What if the very foundations of modern medicine were built on pain, exploitation, and unimaginable suffering? Today, we're diving into one of history's darkest medical stories, the life and legacy of Dr. J. Marion Sims. To some, he was the father of modern gynecology. To others, he was a monster, a man who advanced science through brutal experiments on enslaved women without anesthesia. This is the story of the forgotten monster, Dr. Sims. Before we begin into deep dives about the hidden, darker side of science and history, make sure to hit that subscribe button, drop a like, and turn on the bell. It helps the channel grow and keeps us digging into stories most people are too scared to touch. Now, let's go back to the 1800s. Chapter 1. Early Life and Obsession. The story of J. Marion Sims begins in a place and time where the world was already divided by cruelty. He was born in 1813 in Lancaster County, South Carolina. The backdrop of his childhood was slavery, an institution so normalized in the South that it was simply the way things were. For Sims, this wasn't just the society he lived in, it would become the foundation of his medical career. Growing up, Sims wasn't seen as extraordinary. In fact, his early years showed no hint of greatness. Teachers described him as an average student, someone with neither remarkable intelligence nor clear ambition. Medicine was not his childhood dream. He often admitted later that he stumbled into it almost by accident. But fate or obsession has a way of finding people. At just 19 years old, Sims entered medical training. The state of medicine at the time was brutal. Imagine surgeries without antiseptics, no antibiotics, no real anesthesia. Operating rooms were more like slaughterhouses, where survival depended as much on luck as on skill. Patients endured unimaginable pain, while surgeons rushed through procedures before infections set in. This was the bloody, chaotic world Sims was stepping into. Initially, Sims wasn't a standout. He struggled with his studies and even considered giving up medicine altogether. But then something changed. He began to fixate on women's health, specifically conditions that other doctors avoided. One condition in particular caught his attention. Vesicophy. Now, let's pause here. A vesicovaginal fistula is a tear between the bladder and vagina, most often caused by long, obstructed childbirth. It left women unable to control their urine, constantly leaking, constantly humiliated. In the 19th century, this condition was devastating. Women were often abandoned by their families, ostracized by their communities, and forced to live in isolation. Imagine the shame, the loneliness, the despair. Most doctors ignored this condition. It was seen as untreatable, and worse, socially taboo. But Sims, perhaps out of ambition, perhaps out of ego, saw an opportunity. If he could solve this medical mystery, he wouldn't just be another doctor. He would be remembered. He would become a pioneer. In these early years, we can already see the two sides of Sims forming. On one hand, there was the drive to solve a problem that others wouldn't touch. On the other, there was a willingness, maybe even a hunger, to push past boundaries without concern for the human cost. He wanted results. He wanted recognition, and nothing, not even pain, would stand in his way. The South of the 1830s and 1840s gave him the perfect laboratory. Enslaved people were treated as property, as resources to be used. Enslaved women, in particular, had no control over their own bodies. This cruel reality provided Sims with something no other doctor had: an endless supply of human subjects who could not say no. And in Sims's mind, this was not just acceptable. It was convenient. By the time Sims set up his practice in Montgomery, Alabama, his obsession with women's reproductive health was in full swing. He had found his stage, he had found his subjects, and he had found the condition that would make or break his reputation. What makes this chapter of his life chilling is how ordinary it all seemed at the time. Neighbors, other doctors, even newspapers, treated his experiments as progress. But behind the curtain of praise was a darker truth. Sims's rise would be built not on brilliance alone, but on suffering. We often think of geniuses as people born with talent, but Sims's story shows something different. He wasn't born brilliant. He wasn't even born curious. What set him apart was persistence and obsession that bordered on madness. He would keep cutting, keep stitching, keep trying, until he got the result he wanted. And that obsession, combined with the horrors of slavery, created a storm that would change medical history forever. As we close this first chapter, keep one thought in mind. Medicine is never separate from morality. Every doctor, every researcher, every innovator makes choices about how far they're willing to go. For Sims, the line between healing and harming was already beginning to blur. The young man from South Carolina was no longer just another struggling doctor. He was becoming something else, something dangerous, something that history would remember not just for his discoveries, but for the suffering left in his wake. And in the shadows of this story, waiting to be introduced, are the women who would bear the weight of his ambition. Women whose names Anarcha, Lucy, and Betsy would survive centuries, even when history tried to erase them. This was just the beginning. Chapter 2. Building his lab. When you think of a laboratory, you might picture glass beakers, microscopes, and sterile white rooms. But in the mid-1800s, Marion Sims's lab looked nothing like that. It wasn't a scientific hall of progress. It was a small backyard building behind his house in Montgomery, Alabama. Wooden walls, sparse furnishings, a few surgical instruments. And the people he experimented on, enslaved black women, who had no voice, no choice, and no escape. This wasn't a normal medical clinic. It was more like a hidden theater of suffering. Sims had become obsessed with fixing a medical condition that tormented women after long childbirths, the vesicovaginal fistula. At the time, no one had a cure. Doctors had tried and failed for decades. To Sims, solving this problem was his chance at medical glory. But instead of recruiting volunteers, he used the bodies of women who were owned as property. He convinced slaveholders to lend him these women, promising that if his surgeries worked, they would be more useful. This cold transaction was how Sims filled his lab with human subjects. Inside that backyard building, Sims began his grisly work. He didn't use anesthesia, partly because it was not widely accepted yet, but also because he believed black women didn't feel pain the same way white women did. A racist myth that became his excuse for unimaginable cruelty. Picture the scene, a woman restrained, trembling, as Sims tried surgical procedure after surgical procedure, scalpel, needle, failure, blood, screams echoing in the wooden room. He performed surgery after surgery on the same women, often hundreds of times, without relief. One of the most well-documented was a woman named Anarcha, who endured more than 30 operations under Sims's hand. Imagine the trauma, the endless pain, the hopelessness, yet Anarcha and others had no power to refuse. Their bodies became the testing ground for his ambition, and Sims was not alone. Other doctors, white male physicians, gathered in that small building to watch. It was like a grim seminar, a classroom built on suffering. For Sims, this lab wasn't just a place of experimentation. It was his stage. He was performing not just surgery, but dominance, authority, and control. The women were stripped not only of freedom, but of dignity. Their pain became his proof of genius. As weeks turned into months, the lab gained a dark reputation in Montgomery. Everyone knew something strange was happening behind Sims's house. Enslaved women were sent in, but rarely came out healthy. Some died, some were permanently scarred. And still, Sims pressed on, convinced he was on the edge of greatness. It's important to pause here and really see the contrast. To Sims, this was science. To the women, it was torture. We often celebrate breakthroughs without asking, at what cost? His lab was not just a birthplace of gynecology, it was also a site of horror, a place where human suffering was repackaged as progress. And this duality, innovation wrapped in exploitation, is what makes his story so haunting. By the end of these early years, Sims believed he was closer to finding a solution, but his methods had already crossed a moral line that can never be erased. His lab in Montgomery was not just a backyard shed, it was a chamber that carried screams, blood, and pain into history. And it was only the beginning. Chapter 3, A Life Surrounded by Death. When we look at Marion Sims's story, it's impossible to separate his rise from the world he lived in. The 19th century was an age where medicine was both desperate and experimental. People were dying everywhere: disease, childbirth, infection. Death was not just a visitor, it was a daily roommate. For Sims, growing up in this world meant that human suffering was not an abstract idea. It was right there, in front of him. Every street, every small town, every home. Childbirth could claim a mother in hours. A simple cut could become infected and kill within days. Families expected to bury children before they even learned to walk. This constant presence of death shaped Sims's sense of urgency. He was driven to fix problems, no matter the cost. But here's the catch: sometimes the willingness to do anything leads to dark choices. By the early 1800s, life expectancy was brutally short. Cholera outbreaks swept through cities. Tuberculosis was called the White Plague. Even wealthy families could not escape the grip of disease. For women, childbirth was one of the greatest dangers they faced. Each pregnancy was a gamble, life or death. This was the world that produced Sims. To him, medicine wasn't just science, it was war. Every patient was a battlefield, and if he wanted to win, he needed to experiment, to push past the known boundaries. But that also meant that ethics often fell by the wayside. Doctors were not bound by the same principles we expect today. Consent, as we understand it, was not existent. Patients were often seen as subjects' bodies to study, rather than individuals with rights. And in the American South, the enslaved were considered property. That brutal reality created a cruel loophole. Enslaved people could be used for experimentation without fear of legal consequences. And this is exactly the loophole Sims would exploit. To really understand how shocking Sims's story is, we need to think about how he saw death not as something to be prevented with compassion, but as an obstacle to overcome by any means necessary. He believed he was fighting for medical progress, even if that fight left countless victims in its wake. This mindset, this cold, clinical ambition, was part of the larger culture of medicine at the time. Doctors often competed to be the first to solve great medical mysteries. The race to discovery overshadowed the suffering of those caught in the middle. So, when Sims looked at enslaved women suffering from vesicovaginal fistula, he didn't see human beings first. He saw a problem to solve, a medical puzzle that might bring him fame, recognition, and legacy. Death and suffering were not deterrents to him, they were simply the cost of doing business. And here's where the story gets truly eerie. Sims surrounded himself with women on the edge of death, women whose bodies were failing after childbirth. Their pain became his laboratory. Their lives became his experiments. He wasn't running from death, he was working inside of it. Now, let's step back for a moment. Imagine being one of those women, already suffering, already abandoned by family and community. Now taken into Sims's world, where your pain became a test, a measurement, a tool for his next surgical trial. These women did not choose this. They were forced into it. They lived in the shadow of death every day, not only from their injuries, but also from the man holding the scalpel. This chapter of Sims's life teaches us something chilling. Progress in medicine was not born in clean laboratories or sterile hospitals. It was forged in places of agony, on the backs of the most vulnerable, in an era where death was as familiar as the morning sun. And while Sims rose to fame, the women who endured his experiments were left in silence, their names mostly forgotten, except for a few, like Anarcha, Lucy, and Betsy. Their stories survived only because their suffering was so extreme it could not be erased. When we say a life surrounded by death, we're not only talking about Sims, we're also talking about those who lived and died under his hands. Death was the backdrop, the constant hum, the environment that allowed his career to grow and the environment that destroyed the lives of so many others. Before we move into the next chapter, let me ask you this. How much progress would you accept if it came at this kind of cost? Drop your thoughts in the comments below. I really want to hear your take. And of course, if you're finding this story eye-opening, don't forget to hit that like button. It helps the channel grow and tells me you want more hidden history like this. Next, we'll step deeper into the turning point of this story. The moment Sims began conducting his infamous operations, and the world that enabled him to do it. Chapter 4. The operations begin. The year was 1845. Marion Sims had finally found his patients. But these were not volunteers. They were enslaved black women, handed over by their owners because they suffered from vesicovaginal fistula spinful, humiliating injuries from childbirth. To Sims, these women were not just patients, they were opportunities. Each body was another chance to test, to cut, to try again. And so, the operations began. The most well-documented case was that of Anarcha, a young enslaved woman who had endured a traumatic labor that left her with a severe fistula. She was just 17 when Sims first operated on her. What followed was not one surgery, not 5, not even 10 but more than 30 operations. Each one performed without anesthesia. Now, keep in mind, ether anesthesia had just been introduced in 1846, but Sims refused to use it. Why? Because he believed that black women did not feel pain in the same way white women did. This racist myth gave him the excuse to ignore their screams, their suffering, their humanity. So, Anarcha endured the knife over and over, conscious every single time. She was not alone. Two other women, Lucy and Betsy, also became central figures in his experiments. Together, they were subjected to countless procedures as Sims tried and failed again and again to close the fistula. Imagine being in their place. Imagine the terror of knowing tomorrow might bring another surgery, another round of pain. No consent, no choice, no relief. Sims turned his backyard into what he proudly called his surgical hospital. But really, it was a laboratory of suffering. His medical students, and sometimes even curious neighbors, would gather to watch. These operations were spectacles, entertainment mixed with experimentation. The women, stripped of dignity, became living demonstrations. Each failed attempt only hardened Sims's determination. He believed he was on the verge of solving one of medicine's most shameful conditions. He convinced himself that the suffering of these women was justified, because the results would help countless others. But here's the haunting truth. Progress was built on their pain, not with their consent. Anarcha's body carried the weight of his obsession. More than 30 surgeries meant more than 30 fresh wounds, 30 recoveries, 30 nights of agony. The scars were not just physical, they were psychological, emotional, and invisible to history books for decades. Lucy, after one particularly brutal operation, nearly died of blood poisoning. Sims wrote about her case coldly, as if she were merely a failed experiment, not a young woman fighting for her life. Yet Sims pressed on. Day after day, he operated, stitched, cut, and tried again. Failure was never enough to stop him. For him, the women's pain was not an ending, but an invitation to keep pushing. This cycle, suffering, operation, recovery, then more suffering, became the rhythm of their lives. Finally, after years of experimentation, Sims succeeded. He closed Anarcha's fistula. In the medical world, it was hailed as a miracle, a turning point in gynecology, a triumph. But the triumph belonged to Sims alone. The women were erased, their names, their pain, their sacrifice buried under the glory of a man now celebrated as the father of modern gynecology. This chapter of history forces us to ask, at what cost do we celebrate progress? Sims's operations were successful, yes, but success came at the expense of enslaved women who had no voice, no agency, and no recognition. Their screams were silenced, their stories erased, their humanity denied. And yet, their suffering is what gave rise to medical knowledge still used today. Before we continue, I want to hear from you. Do you think Sims's work should still be celebrated, knowing the price it demanded? Drop your thoughts in the comments, I'll be reading them. And if this chapter has left you stunned, make sure to hit the like button and share this video with someone who needs to know this forgotten history. It helps spread awareness and keeps these stories alive. In the next chapter, we'll step back and look at Sims himself. Who was this man outside of the operating room? What drove him so relentlessly, and how did he justify what he was doing? Chapter 5. Behind the mask of the father of gynecology. On the surface, Marion Sims looked like a man destined for greatness. He was ambitious, determined, and utterly convinced of his own brilliance. In his own words, he was bold enough to say he was not only a doctor, but a pioneer. But behind that polished image, behind the title of father of gynecology, was a man whose methods and mindset were far more disturbing. Sims was born in South Carolina in 1813, in a society built on slavery. From an early age, he absorbed the racist ideas that were woven into the culture of the South. To him, enslaved people were not equals, they were property, tools, resources to be used. This belief shaped every decision he made as a doctor. It gave him permission, in his own mind, to treat black women as subjects for experiments, not as human beings. His early medical career was unimpressive. In fact, Sims himself admitted he struggled in school. He wasn't a top student. He didn't start out as a prodigy, but what he did have was persistence, a stubborn refusal to quit even when his patients paid the price. He had a reputation for arrogance, for believing he knew better than everyone else. And when he finally discovered a condition no one had yet solved, vesicovaginal fistula, he saw his chance. Sims wasn't just practicing medicine, he was building a legacy. He wanted to be remembered. He wanted history to write his name in bold letters. And to do that, he needed a breakthrough. The women he experimented on became the means to that end. In his own mind, their pain didn't matter compared to the glory of his discovery. What's chilling is how he justified it. Sims claimed he was acting in the name of science, for the good of humanity. He told himself, and later the world, that the suffering of a few was worth the salvation of many. But that logic ignores something fundamental. Those women did not choose. They were never given a voice, never given a choice, never given the humanity that Sims so easily claimed for himself. He surrounded himself with students and supporters who praised his genius. He built a network of admirers, who saw him as a man pushing the boundaries of medicine. His confidence, his charisma, his determination, they made him hard to challenge. And when he succeeded with Anarcha surgery, his reputation skyrocketed. He became the man who solved the unsolvable, a pioneer, a hero. At least, that's how the story was told. The mask of the father of gynecology hid the darker truth. It hid the screams, the tears, the blood. It hid the fact that his patients were enslaved women who had no power to refuse. It hid the racism that allowed him to operate without anesthesia, claiming they could endure pain differently. History celebrated the mask, not the reality. Even later in life, Sims showed little remorse. In his autobiography, he described his experiments in cold, clinical detail. He never once questioned whether what he had done was wrong. He believed he was chosen, destined to advance medicine no matter the cost. That certainty, that lack of doubt, is what makes him so unsettling. He did not see himself as a villain. He saw himself as a savior. The paradox of Sims is this: he was both a medical pioneer and an oppressor. A man who pushed the boundaries of surgery, yet crossed every boundary of ethics. A man remembered for saving lives, while erasing the ones who made his success possible. It's a paradox that forces us to rethink how history writes its heroes. Quick pause. If you're finding this story eye-opening, hit the subscribe button and turn on the bell. We uncover hidden histories like this every week, and trust me, you won't want to miss what's coming. Now, in the next chapter, we're going to dive deeper into the consequences of Sims's work. Yes, his surgical techniques spread across the medical world. But what happened to the women who endured his experiments? What legacy did they leave behind? Chapter 6. The aftermath of pain and progress. When Sims perfected his surgical technique on Anarcha, the medical world changed forever. Suddenly, a condition that had once doomed women to a lifetime of shame, isolation, and despair had a potential cure. For the first time, doctors could repair vesicovaginal fistulas. It was groundbreaking, but the cost of that progress was hidden behind closed doors and buried under silence. Anarcha, Lucy, Betsy, names that should be etched into the foundations of gynecology, were left with scars, physical scars. Emotional scars. Scars history almost erased. Sims wrote about them only as cases, not as human beings. Their suffering was reduced to footnotes in his story of triumph. As Sims's fame grew, he left the South and took his methods to the wider medical community. He opened a hospital in New York. He performed surgeries on wealthy women, now with anesthesia, which by then had been adopted into practice. The irony is hard to miss. Enslaved black women endured agony without pain relief. Elite white women received the same procedure with the benefits of modern medicine. This double standard wasn't accidental. It was a reflection of the racial hierarchy that defined Sims's world, and still echoes in ours today. Sims's reputation soared. He was invited to Europe, where he demonstrated his surgeries in front of kings, queens, and leading physicians. He was celebrated as a genius, a savior of women, a pioneer of gynecology. Statues would later be raised in his honor. Textbooks would praise him. Generations of doctors would learn his name. But the women, whose bodies carried his success, they were forgotten. Their names, their voices, their humanity all erased from the narrative. This is the cruel paradox. Sims achieved genuine medical progress. His work helped countless women in the decades that followed, but it was built on exploitation, built on pain, built on a foundation of racism and power imbalance. The question is, can progress ever be separated from the suffering that created it? Today, this legacy still haunts medicine. Studies show that black women are more likely to be ignored when they report pain. They are more likely to suffer complications in childbirth. They are more likely to die giving birth compared to white women. These disparities didn't appear out of thin air. They are rooted in centuries of bias, myths, and practices like those that Sims embodied. In recent years, activists and historians have fought to reclaim the stories of Anarcha, Lucy, and Betsy. They are no longer just subjects of experiments. They are remembered as women who endured unimaginable suffering, and whose bodies were sacrificed for the advancement of medicine. In 2018, after years of protest, a statue of Sims in New York's Central Park was finally removed. It had stood there for over a century, honoring him while erasing the women whose pain had built his legacy. The removal wasn't just about taking down a statue, it was about telling the truth. About refusing to let progress be celebrated without acknowledging the price that was paid. Sims himself never admitted any wrongdoing. In his autobiography, he presented himself as a man of science, a man chosen to advance the field. But history has begun to unmask him. His title as the father of gynecology now comes with an asterisk, recognition that the foundations of modern medicine were built on both brilliance and brutality. This is the uncomfortable truth. Progress and pain are often intertwined. Scientific breakthroughs rarely come without human cost, but the question we have to ask is this: who bears that cost? Who is sacrificed, and who gets remembered? For Sims, the answers were clear. Enslaved black women paid the price. He reaped the rewards. And the echoes of that injustice still shape the world we live in today. Before we move forward, let me ask you this. Do you think history should separate Sims's contributions from his cruelty? Or should his name always carry the weight of the suffering behind it? Drop your thoughts in the comments side. Love to hear your perspective. Because, in our next chapter, we're going to explore something even more complex. How Sims became a medical celebrity, while the women he experimented on vanished from the story. Chapter 7. Erasing the Women, Elevating the Man by the Mid-19th Century. Marion Sims was no longer just a Southern doctor. He was a rising star. His name carried weight in medical circles. His reputation as a brilliant surgeon began to cross borders, oceans, and social classes. But with every step upward in fame, the women who made his work possible fell further into the shadows. Anarcha, Lucy, Betsy, their names weren't spoken in lecture halls. They weren't written in textbooks. They were reduced to patients in Sims's notes, faceless subjects in medical case studies. Instead of being honored, they were erased. Sims moved to New York City, where he built the Women's Hospital of the State of New York, the first hospital dedicated exclusively to women's health. Wealthy patients flocked to him. Suddenly, the man who had experimented on enslaved women in Alabama was treating high society ladies in Manhattan. The hypocrisy couldn't be more striking. For white women of privilege, anesthesia was standard. Comfort, dignity, and safety were prioritized. For black women, especially enslaved women, those same considerations had been seen as unnecessary. Medical journals celebrated his miracle cures. European royals welcomed him into their courts. Statues were raised in his honor. He was called a savior of women. But the question remained: which women? The women who endured dozens of experimental surgeries without pain relief were never given the same spotlight. Their suffering was hidden behind Sims's carefully crafted public image. This wasn't just about one man's ego. It reflected the broader systems of racism, classism, and sexism that decided whose lives were valued, whose pain mattered, and whose names were worth remembering. By erasing Anarcha, Lucy, and Betsy, History elevated Sims as a lone genius, a hero standing on a pedestal while the women became invisible. And yet, without them, there would be no story, no breakthrough, no father of gynecology. That's the bitter irony. Sims became immortal in medical history. The women who endured his scalpel were nearly lost to time. But, as we'll see in the next chapter, their silence wasn't the end of the story. The consequences of that erasure would ripple across generations, shaping not just medicine, but the very way society viewed women's pain. Chapter 8. The Long Shadow of Silence. The story of Sims and his experiments didn't end in the 19th century. His shadow stretched far beyond his lifetime, lingering in ways that still affect medicine today. For decades, medical schools praised him. Statues stood in his honor. His textbooks were required reading, and the women in Anarcha, Lucy, Betsy remained silent, their stories untold, their names forgotten by the institutions that benefited from their suffering. But silence doesn't mean absence. The legacy of Sims's work carved itself into the very foundations of gynecology. More troubling, it carved itself into society's perception of pain, especially the pain of black women. Even today, studies show that black women's pain is often dismissed or underestimated in hospitals. They are more likely to be ignored, less likely to be given adequate pain relief, and more likely to die from pregnancy-related complications. The echoes of Sims's operating room still reverberate in modern wards. The long shadow is also cultural. For years, Sims's image represented progress and triumph, while the women who made his experiments possible were written out of history. Their silence became a weapon, reinforcing the idea that medical heroes could not be questioned, and that suffering in the name of progress was acceptable, even noble. But in recent years, that silence has begun to crack. Activists, historians, and communities have fought to bring Anarcha, Lucy, and Betsy back into the story. Statues of Sims have been torn down. Memorials for the women have been raised. Their names, once erased, are being spoken again. The shadow of silence, however, still asks us a question. How many more names remain buried? How many breakthroughs were built on the backs of those who were never acknowledged? Sims's story is not just about one man, it's about power, exploitation, and the selective memory of history. To confront the shadow is to confront the uncomfortable truth that progress often comes at a cost. The challenge is deciding whether that cost is ever justified. In the end, the women once silenced are speaking again through us. Their suffering demands not just remembrance, but reflection. And perhaps, that is the truest legacy. Not Sims's fame, but the voices that refuse to remain forgotten. Final conclusion, the story of Dr. J. Marion Sims is not just history, it's a mirror reflecting how progress and cruelty can exist side by side, how society chooses who gets remembered and who gets erased, and how, even today, echoes of that injustice ripple through our hospitals, our textbooks, and our collective memory. Yes, Sims advanced medicine, but he did so by exploiting women who had no choice, no voice, and no protection. Anarcha, Lucy, and Betsy weren't nameless patients. They were human beings. Their pain was real, their resilience was extraordinary, and their silence was forced, not chosen. When we remember Sims, we must also remember them, because the story of modern gynecology doesn't belong to one man, it belongs to the women who paid the price. And here's the truth. Stories like this matter because they ask us to look deeper, to question the heroes we've been taught to admire, to challenge the systems that still, in many ways, treat some lives as more valuable than others. So now, I want to hear from you. Do you think medical progress can ever justify suffering like this? Should Sims be remembered as a pioneer, a villain, or something in between? Drop your thoughts in the comments. I'll be reading and responding. If you found this story powerful, don't forget to hit that like button so more people can discover it. Subscribe to Hidden Science for more deep dives into the forgotten, the unsettling, and the mysterious corners of history. And if you want to keep going down the rabbit hole, check out our next video. Right here, it's another story that will leave you questioning everything you thought you knew. Until then, remember, the past is never really gone. Its shadows are still with us.